Hi, welcome to the EQ Video Library. I'm here with Kathie and Davey. Hi Catherine.
Hello.
What is your current job?
My current job is a registered general nurse and I work in the community setting.
Great, and tell me, what does that entail?
It involves having referrals from GPs to ask us to go and visit patients at home. It is a service for housebound patients, so there's quite a number of them. We would go out and assess to see if there's any equipment, if we need social service involvement. It could be that they've been discharged from hospital and it might be removal of clips or sutures, wound dressings. Yeah, it's quite varied.
Okay. What did you want to be when you left school?
I wanted to be a nurse and that is what I sort of planned to do, but I didn't get much encouragement whilst I was at school.
Right. Okay. What did you do when you left school then?
The careers teacher that we had as my end of year, we have a careers talk, and I'd said to her that I would like to become a nurse, and her answer was, "Oh, Catherine, there's lots of fields around where you live. You will always have a job. There's plenty of pre-pack houses and land work, basically." And because I thought she was the expert, so she must know that I would never become a nurse, that's what I did. So I worked on the land, I've worked in shops, pre-packs, yeah, I've done quite a few different little bits to get by, but it's given me a lot of skills as well,
Yeah.
a lot of people skills.
Sort of helped you along the way.
Yeah, definitely.
How did you eventually get into what you do now?
I've got 2 children,
Yeah.
and when my son was about to start school, I was going to be, there's a bit of a void there, so I decided that I was going to try and do the career that I wanted. I applied to a night college, so I went in the evenings and did maths and English, which I passed, and I was really pleased. And then from there, I applied to do an Access to Higher Education course, which is a year-long course, and it sort of like enabled me to get all the extra qualifications I needed with recent study, which I passed as well, obviously. And I'd like to see the careers teacher now and say, look at me now. Yes. Yeah.
Somebody leaving school now, what sort of qualifications would they need?
You still need to have your GCSEs or your A-levels, but what they're looking for is about 4, it used to be 4 GCSEs when I was doing it, but you will have to have maths and English. But there is various ways of accomplishing that. You can start off as a healthcare worker and develop your role. You can do what I did, the Access to Higher Education, which did cover maths and English again. You know, there is different ways that it can be achievable.
You prove that there's other ways in.
Definitely.
Yeah, other ways into doing it.
Don't ever think because somebody says you can't do that, don't listen to that. If you want to do it enough, you'll do it.
Good. What is the best bit of your job? What do you enjoy most?
I like going, because it's in the community, I like going to the different places, different streets, different houses, meeting different people. That's the biggest thing that I like. If they're a bit, like on a first visit, people could be a bit shy or don't want to come forward a little bit. But I think once you get in the home, which you should be privileged that you're doing that because people live differently to what you may do. But once you're in there, you only have to look at a couple of pictures or see what ornaments they've got. And that's normally a bit of a breaker, so you can start a conversation off and get to know the person a bit better. Yeah.
What are the worst parts of your job or the more challenging parts?
I think the more challenging is the time frame sometimes that you've got to do a job. Obviously, you know, there is times when you can go straight in and out, but there's other times where you may have done that previously, but you're not able to do that on this occasion. Maybe there's something else that's happened or gone wrong, you know. So that's a bit of a challenge, trying to work everything in. But it's, you know, I like that. I quite like the challenge, yeah.
And I get the impression you definitely recommend it to somebody leaving school.
Yeah, what I'd say is, if they was thinking of doing nursing, get some skills first as a carer. It'll sort of help in the long run, or some, you know, if you've got some life skills, just something that you've picked up on the way, rather than leaving straight from school and thinking, that's it, that's all I'm going to be, which is wonderful, you know, because we need more nurses. But to spend a bit of time either working a little bit in a nursing home or residential home, just get a full feel of what you may be asked to do. But it's very rewarding, yeah.
Brilliant. I'm glad you enjoy it.
Thank you.
Right, thank you, Catherine.
Thank you.